tingling feet, a burning sensation that won't stop, the feeling of walking on broken glass, even when you're standing still on solid floor. If any of that sounds familiar, here's something your doctor may never have told you. The answer isn't in a pill bottle, it's in your living room, with a chair. Researchers at the University of Utah took skin samples from neuropathy patients before and after a structured exercise program. Under the microscope, they saw something extraordinary: new nerve fibers, growing back, not improved symptoms, not patient-reported relief. Actual measurable nerve regeneration, visible in human tissue. That changes everything about how we should be approaching this condition. 1 in 4 people over the age of 70 is living with peripheral neuropathy right now, and the majority of them are doing the wrong thing, waiting for medication to fix what movement can actually heal. Here's what's really happening inside your body. Your peripheral nerves are the communication cables running from your spinal cord all the way down to your feet and toes. They carry critical signals: pain, temperature, pressure, and proprioception, your body's sense of where it is in space. When those cables become damaged, the signal gets scrambled. Your brain receives noise instead of information. That scrambled signal is the burning, the tingling, the numbness, the instability when you walk. The leading cause is diabetes, responsible for roughly 40% of all neuropathy cases. Elevated blood sugar binds to nerve proteins through a process called glycation, physically degrading the nerve fibers over time. But diabetes isn't the only culprit. Alcohol directly poisons nerve tissue and blocks absorption of vitamin B1. Vitamin B12 deficiency, particularly common in patients taking metformin or omeprazole, is another major driver. Chemotherapy, autoimmune disease, obesity. And in 30% of diagnosed cases, doctors never identify a cause at all. Before we get to the exercises, a brief word on supplements, because the evidence here is specific and worth knowing. Alpha-lipoic acid at 600 milligrams daily has the strongest clinical backing. 2 major trial series, Sydney and Nathan, tested it across hundreds of patients and documented a 30 to 50% reduction in pain and tingling. Vitamin B12 is worth checking through a blood test, especially if you're on long-term metformin. And this one surprises most people. Vitamin B6, when taken above 50 milligrams daily, doesn't help neuropathy. It causes it. Check your multivitamins carefully. Now, the 6 exercises that the science actually supports. Cardio is the foundation. It was aerobic exercise that triggered measurable nerve fiber regrowth in the Singleton study. Without it, every other exercise delivers diminished results. The target is 150 minutes per week. Walking, a stationary bike, swimming, whatever your body tolerates. But here's a version you can do at home, right now, with 0 fall risk. Sit upright in a sturdy chair, spine straight, away from the backrest. Begin lifting your knees alternately, like a seated march. Add opposite arm swings to increase intensity. Your breathing should elevate slightly, enough to feel it, not enough to stop talking. Begin with 3 minutes. Add 1 minute every few days until you're reaching 10 to 15 minutes, twice daily. That alone is your aerobic baseline. Single leg balance. This is where fall prevention begins. Neuropathy disrupts proprioception. Your body loses its ability to sense the floor beneath your feet precisely when it needs that information most. The result is falls. And for anyone over 60, a fall frequently means a fracture, surgery, and months of lost mobility. Stand behind a chair, both hands resting on the back. Shift your weight to your right foot. Lift your left foot just 1 inch off the floor. Hold for 30 seconds. If you can only manage 5 seconds right now, that is your starting point, not a failure. 3 rounds on each leg. As it becomes easier, try 1 hand, then no hands, then close your eyes. That last step is where the real neurological work happens. With vision removed, your brain is forced to rely entirely on the damaged nerve pathways. demanding more from them, and in doing so, strengthening them. Progress is measurable within 2 weeks of daily practice. Heel-to-toe weight shift. Stand with feet shoulder-width apart, one hand on the chair. Slowly rock your weight back onto your heels, toes lifting slightly. Hold 1 second. Then roll forward onto your toes, heels lifting. Hold. 15 repetitions, 2 sets, slow and controlled. This exercise does 3 things simultaneously. It trains balance, strengthens the calf, and directly stimulates sensory receptors across the entire sole of the foot. 3 benefits, 5 minutes. If you're finding value in this breakdown, this is exactly what we do at Strategic World Insights, cutting through surface-level information to give you the evidence, the mechanism, and the practical application. Subscribe now so you don't miss what's coming next. Calf raises. Standing at the chair, rise slowly onto your toes, pause 2 counts at the top, lower slowly back down, 12 repetitions, 2 sets, 30 seconds rest between them. The calf muscle functions as a circulatory pump. Each contraction forces blood upward through the veins. Each release draws fresh, oxygenated blood down to the feet. More circulation means more oxygen delivered directly to damaged nerve tissue. Simultaneously, every rise and fall sends a proprioceptive signal traveling from the sole of your foot, up through the spinal cord, all the way to the brain. You are training the entire nerve pathway simultaneously from one simple movement. Towel scrunches. Sit down. Lay a thin towel flat on the floor. Place your bare foot on the near edge. Using only your toes, scrunch the towel toward you. Spread, grab, squeeze, pull. 10 repetitions per foot, 2 sets. The first time you try this, your toes may feel completely unresponsive. That disconnection is precisely the point. You are activating nerve-to-muscle pathways that have gone quiet. Every session reestablishes a little more of that connection, as your brain learns to route signals through whatever functioning fibers remain. Ankle circles and the alphabet. Seated, lift 1 foot slightly off the floor. Rotate the ankle in slow, full circles, 10 times clockwise, 10 times counterclockwise. Then, using the tip of your big toe, write every letter of the alphabet in the air. Each letter traces a different path, activating different muscles throughout the lower leg and foot, from angles no standard exercise reaches. The complete daily routine takes 15 minutes, seated march to warm up, single leg stand and heel-to-toe rocks for balance, calf raises, towel scrunches, and ankle circles for the feet. Simple, structured, backed by evidence. 3 rules that determine whether this works. Start at half the prescribed volume. Nerves respond to gradual progression, not sudden load. Be consistent every single day. 15 minutes daily outperforms 1 hour weekly because nerve healing is a slow, continuous biological process. And check your feet after every session. When sensation is impaired, damage can occur without any pain signal reaching you. The science is no longer theoretical. Nerves can regenerate. The mechanism has been observed in human tissue. The exercises that drive that process are simple, accessible, and require nothing more than a chair and 15 minutes of daily commitment. Pair that with a B12 check, blood sugar management, and a conversation with your doctor about alpha-lipoic acid, and you are no longer waiting for neuropathy to worsen. You are actively working against it. That distinction is everything.